While the vaccine is now easier to access, the rate of those eager to roll up their sleeves is slowing, or at least it seems. Our Alex Tejada explains.
Tom, state health leaders acknowledge that some people refuse to get the vaccine, but believe that others just need access or their questions answered. With 22 new deaths announced today, the largest number since early February, as well as younger people being hospitalized for COVID, they have their work cut out, and time is of the essence.
Percent of cases that have become hospitalized has gone up a bit from the prior waves to this one in all age groups over the age of 20.
And still continue to impact those in certain zip codes more than others.
That kind of shows you that we still have work to get protection into all parts of our state. Otherwise, we will continue to see some disproportionate impact.
The pandemic has disproportionately affected minority populations. In order to better address this, the state is ranking areas based on what they call a social vulnerability index. This will help determine which areas need more doses.
By setting an equity allocation goal of 40% of doses focused on high SVI zip codes and equity efforts, we aim to eliminate the current gap in first dose immunization rates between Minnesotans from high SVI zip codes and our state's overall first dose immunization rate.
All in an attempt to combat what is being called vaccine hesitancy. State leaders called this a myth, saying in many cases it's a matter of access.
We're at a place now where people aren't coming to us to get the vaccine. We have to bring it to them.
Of course, there are still those who are classified as vaccine resistant, those with no plans of getting vaccinated, even if doses are easily made available to them.
Different groups of people have different questions about specifics of the vaccine for them.
This creates a gap in vaccination rates and a hurdle for state health leaders to overcome. It begins with education, especially concerning the previously paused Johnson & Johnson vaccine.
The data showed that the benefits of this vaccine outweighed the very small risk.
And while the single-shot vaccine is safe and effective, many Pfizer and Moderna shots are proving less effective, as more than 3% of Minnesotans are not getting the second shots of these two brands.
But that's still concerning to us because we know that the Moderna and the Pfizer products, you need to have both doses to have complete protection.
While the metro area of Minnesota showed a growth in the number of those getting vaccinated in April, the numbers were less encouraging in the western half of the state, with both the northwest and the southwest regions of Minnesota experiencing less than a 20% increase in those getting vaccinated. Tom, back to you.
All right, thank you, Alex.